Hello.
Hello, doctor.
Hi, how are you today?
I'm okay, doctor. Thank you.
How may I help you?
And well, I'm here because of this mole, doctor. You see this one on
See.
the back of my hand, and recently I've noticed it's been changing and getting a little bit bigger and itchy. Sometimes it actually, if it catches, then it bleeds. So yeah, I just wanted
It can
to
be
have it
worse.
checked.
Yeah.
Mm.
So you mentioned that it's sometimes bleeds, and you also mentioned that it's increased in size. Did you notice any increase, in like the depths of the mole?
I haven't noticed that. It's just that, um, it was there for 2 years, and then it's started to get itchy a little bit, and now I'm more aware of it.
I
So,
see. Did the
yes.
color change?
Um, I don't know, maybe, but it just, I think it's got bigger, but color, I'm not sure.
I see. So, have you had any skin disorders before?
I didn't, but my mother had skin cancer. She
Sorry
had
to
it on her face and back, I think, and then they had to take it off basically.
Let's see. Do you know the type of cancer?
Not really. I don't know. I thought there's just one type. So
I see.
um, yeah. Is it? Do you think is it possible to be cancer? Do you think?
We can't say for sure now, but we can arrange a biopsy for you. Are you okay with that? Do you know about biopsy?
Biopsy? No, not really. What is that?
So they take a small sample of the tissue from the skin. It's usually painless for this specific procedure, and it's very unlikely that does not leave any scar. So do you agree to undergo that?
You mean you take a piece of it and then
A very small piece. It's you will not notice it.
and it's not hurt? It doesn't hurt?
It's should not hurt that much. It's usually they give you anesthesia, like local anesthesia, and it's a relatively painless procedure.
So what if it comes up as cancer?
So I understand that could be a worrying issue for you, even if it's cancer, which we hope it's not, and biopsy can either rule it out or give us the exact diagnosis. There are very good treatment options for it. There are very surgeries that are done on a small section of your skin, so most likely it will be treated very well.
Okay, doctor, my hobby is actually going out and fishing and being in the sun. And does this mean that I might get this cancer again? Or
Yes, it's better that you try to avoid being outside in direct sun as much as you can, and even if you have to, you should use sunscreen 30 minutes before you're going outside, and you have to renew it every 2 hours. And also, you should for sure avoid tanning beds. You should not try to get tanned.
no, I don't do that. It's just that basically I have no other hobby. It's just
I see.
traveling and fishing and camping and being in the sun really, and I can't do without that. If we take out the cancer, would that reappear in the same place?
It's just as likely as in any other place, but you have to avoid the sun as much as you can. That's the major risk factor for it. And you also said that your mother had a cancer that we don't know. If you can provide us with any medical history about that, that would be helpful too.
Well, I
And
don't know. It's just that she died of that,
oh, I'm sorry
basically.
to hear. I'm very sorry.
Okay. So, okay, doctor. Okay, thank
Yeah,
you.
You need to just avoid the sun as much as you can. And if you're worried about any other issue, you can contact me at any time.
Okay. Thank you.
Okay.
Okay. So, how was that?
I think it wasn't bad. It was good.
Good. Okay. Mole on the back of the hand, and right. So, how old was the patient? 42. 42. Query cancer. It wasn't a very good scenario. In fact, I think we usually we don't take a piece of that. I mean, if you think it might be melanoma, we just do an excision biopsy. Yeah.
Yeah, but the issue is I didn't know what it is. Like it doesn't. I said a piece of skin. I didn't say it. If I said I misspoke probably.
Mhm. Okay. So, what's your feeling?
Um, it was good, like 7 to 8, I would think.
Why 7 to 8? Why not 8 or 8 to 9?
I think like it was hard to like go with a structure with it.
Mm-hmm.
I think. Um,
Right. Why?
I don't like maybe because patient had like changed their agenda maybe.
Mm-hmm.
Like at first they were like worried about this, then like they were worried about biopsy, and then they were worried about the like going outside in the sun.
Mm-hmm.
I think maybe that could be the reason. But
Okay, changing agenda. So you felt that the agenda was changing. Uh, right.
and
Okay,
also yeah, and also like the patient would like I wanted to ask more questions, but the patient would just continue to talk, and I didn't want to interrupt them.
good. Okay.
So yeah, I thought it's better not to interrupt them. So I'm not sure even the parts that I did not ask were important or not. Probably not.
Okay. Right. So what did you want to ask?
Like for example, if his father had any or anyone else and any cancer history.
Okay.
Yeah.
Mm. Okay. What else did you want to ask?
Uh, I forgot. I think this was the major thing.
Okay. Um, okay. So which part do you think you could do differently?
Mm, The report I think was good.
Okay.
The information gathering was acceptable, I think. ICE I think was good because I think I addressed all of patients' concerns. And information giving was I don't know if I chunked enough or not. That's like I haven't
Hmm.
like
It was okay, but
okay.
so the eyes, and you said the eyes was changing. You had the feeling it was changing, and maybe it was. But let's see, was there any cue?
Um like he was worried that his mom had cancer, so his worry first was cancer. Then his worry was when I said biopsy, his facial expression changed. He became very worried about it that I addressed. And also at the end, like he said, like I all of my hobby is like this, going outside and being under the sun. So I got the feeling that he may think if he gets rid of this cancer, he can just go in the sun
Hmm.
like with no limitation.
Right. Yes. Then, in fact, the mother had cancer. That's a cue. So, what you could do was to say that you ask what kind of cancer, and I said I have no idea. But what you could say was that okay. So, what was done for it? And I said, well, I would say yes. She had surgery, quite big surgery with a lot of scars, and then she
Uh,
died. Okay.
Yes.
and then you could say that it's probably melanoma rather than something else. Um, uh, okay. Uh, you asked about the depth of the mole. Well,
Yeah,
patients.
that was my mistake. I just blanked. I didn't know what to
Yeah.
ask. And I
Okay.
remember that melanoma, like, it gets like sometimes like, how can I say? It's like gets a little 3D, like it's like the surface is like uneven. So
Okay.
it just, yeah, but it wasn't a good question. I accept.
Yeah. For moles, you do A, B, C, D, E. You know, A is what is A?
Appearance, border, and color.
Uh,
Yeah.
A
B is
is
depth.
B is border. No, A is asymmetry.
Oh, you're right. Yeah.
Asymmetry, border, color, D for diameter, and changing in diameter or more than 6 millimeters. And
Mhm.
E is evolving or changing, which is itchiness or uh, bleeding. Okay. Yes, going out was also repeated 2, 3 times. Being in the sun or fishing and no other hobby. That's and then so what can you say to that if somebody insists that well, but that is my only hobby.
I can just tell them the risk, like that it's like the major risk factor for skin cancer.
Okay. Yeah, exactly. You can just say you can just um, clarify your position. You say, well, I'm just here to give you the best advice and to warn you, but what you want to do with your life, that's up to you. It's just yes, you did say the major risk factor for melanoma is sun. Uh, but then you need to clarify that and emphasize why you're saying this. And you need to say, well, look, I have to tell you this, and there's nothing else I could do. But if you want to prevent cancer, you need to make sure you're protected against the sun.
Yes.
Um, Good. So
How much do you think my score would be like on this speaking
I
part?
think you score very high. I think
Okay.
you would definitely go above 400. I think.
Okay.
Yeah, because your language is natural. You have a good command of English. You make very little impression of. You're not ambiguous. Basically, you communicate well. Just few mistakes, in pronunciation or structure. Okay. Um, no, I think you will you will be very good. So
Thanks
don't
very
worry
much.
about that.